You are welcome to my channel. Thanks for visiting. Thanks for remembering to subscribe, sharing all my presentations, and listening to this very one. Today, I will briefly go through typhoid vaccines. Some will ask, do we really have typhoid vaccines? Others will ask, are they really effective? Okay, no problem. Let's go. Now, for full note on typhoid, otherwise known as enteric fever, either typhoid or paratyphoid fever, vis-a-vis epidemiology, the causative agent, clinical features, how to make the diagnosis and treatment, including vaccination, please kindly click on this very link. That will take you to the full note on enteric fever. Now, typhoid vaccines could be typhoid V1, Vivotiv, Typhoid, or Typhoid. The types here could be TY21A in live attenuated, that was licensed in Europe in 1983. V1 polysaccharide, meaning polysaccharide subunit, was licensed in United States in 1994. While TCV, meaning typhoid conjugated vaccine, was licensed in India in 2013. The IM, the ones you can give through intramuscular route, is non-live attenuated. Now, it could be inactivated, that is non-live attenuated, and live attenuated vaccine. Dosage forms could be in form of capsule powder, that is enteric coated. That would be live attenuated. Typhoid V1 is purified V1 capsular polysaccharide at 25 microgram per 0.5 ml from Salmonella typhi T12 strain. Typhoid is V1 capsular polysaccharide, and Vivotiv is viable S typhi TY21A 2 to 10 times 10 raised to power 9 units. That will be an injection or solution form, and it is inactivated. Now, on administration of typhoid vaccine, I have written here that you should ask me how to give these vaccines intramuscularly or per hour. Well, briefly, intramuscular should be D by M, and you can choose to give it subcutaneously, but there is no intravenous use here. And the live attenuator is given per aura, but if you want more detailed info, please kindly click on this very link. That will take you to full note on enteric fever, otherwise known as typhoid or paratyphoid fever. Uses of typhoid vaccines is meant for immunization against Salmonella typhi for 1. Travelers to endemic zones, 2. Those with history of contact with carriers, 3. Those with history of contact with an individual with active infection with Salmonella. 4. To lab technicians exposed to Salmonella typhi. 5. Those with decreased immunity and they are traveling to endemic zones. But it is not a routine vaccination. The typhoid vaccine is ineffective against most Salmonella paratyphi. Remember, you can pause and rewind. The last slide I just said for Salmonella typhi. When vaccinated travelers are infected, it is most likely they are now infected with paratyphoid, meaning if the travelers have been vaccinated, they've been vaccinated against Salmonella typhi, not paratyphi. So if after vaccination they find themselves in endemic zones and they are down with enteric fever, remember enteric fever means typhoid and paratyphoid. So they are down with paratyphoid. They are down with paratyphoid because they have not been vaccinated against paratyphoid. V1 polysaccharide typhoid vaccine, but S paratyphoid lacks the V1 polysaccharide antigen. So V1 polysaccharide is from Salmonella typhi. V1 polysaccharide vaccine is a single IM dose or subcutaneous injection every 2 to 3 years if you are traveling very frequently. Now, the TY21A vaccine is live attenuated, is given per aura, and you take this per aura start, then you take the alternate days to a maximum of 3 to 4 days. For example, if you take the first dose on Sunday, the second should be on Tuesday, the third on Thursday, and the fourth on Saturday. But you need to have revaccination every 3 to 5 years. The TC or VITT, that is typhoid conjugated vaccine, here the V1 antigen is linked to tetanus toxoid and is given as intramuscular injection single dose. It is now available in Europe and North America. It's found in India. Vivotif per aura is 4 doses, 1 capsule on days 1, 3, 5, and 7, given a week before traveling to the endemic zone. Repeat the full 4 doses every 5 to 7 years. Typhoid V1 or Typhoid is given intramuscularly at 0.5 ml, given at 2 weeks before traveling to the endemic zones, and you repeat every 2 or 3 years. In pediatric age group, the same dosage as in adults at the same intervals, but you will not give per aura unless the child is greater than 6 years. Intramuscular vaccination is meant for children 2 years and older. Adverse reactions in duration and pain at the site of injection, and could be malaise, headache, fever, muscle tenderness, myalgia, and pruritus. Still on adverse reaction, there may be anaphylaxis, nausea and vomiting, VBS, dizziness, hypotension, angioedema, and abdominal pain. This is Guillain-Barré syndrome, right? When it comes to typhoid vaccines, there are contraindications. Many people might be interested to have it, but not everybody will be given. When there's history of hypersensitivity to typhoid vaccines or to the components of its formulation, no typhoid vaccination today. If you're pregnant, no. If you are immunocompromised, no live attenuated. Inflammatory bowel disease, no. Acute febrile illness, no. Acute gastroenteritis, no. Drug-drug interactions, I'll leave that to your pharmacist and your clinical pharmacologist. Please make appropriate contact with them, please. Monitoring. Yes, we have to wait for 15 minutes and check for anaphylaxis or syncope. If that is present, then, anaphylaxis in particular, will give EpiPen. EpiPen in North America, adrenaline in Europe, and Benadryl and corticosteroid, with or without salbutamol. That means we are reversing the anaphylaxis. Place patient supine with an lumbar position to enhance cerebral perfusion. Still on warning, syncope, shoulder pain, and bursitis from dietary injection, hypersensitivity, and we have to be careful in people with bleeding dyscrasias, particularly when we're administering the intramuscular route. Never for the treatment of typhoid fever, meaning anyone that we are sure we are highly suspicious to be down with typhoid fever, that is not the time to go for the vaccine, no. Defer if there is persistent vomiting and diarrhea, particularly in live attenuated form, that should be given per aura. Still on warnings, don't use anticoagulants while using the intramuscular route, please. If this individual is immunocompromised, no live attenuated vaccine. It may not give an effective immunity in some recipients. So that will answer the question, or one of the questions asked at the beginning, that do you think the typhoid vaccines are really effective? The answer might be yes and might be no. They are not effective in some recipients, particularly those that would then contract Salmonella paratyphi. Remember, these vaccines are going to deal with Salmonella typhi. So an individual already given the vaccine can still come down with typhoid that will be due to Salmonella paratyphi. Now, the last bus stop. If you are given the form, the typhoid vaccine formulation that should be administered intramuscularly, that should be given 2 weeks before exposure to the pathogen, right? But if you are given the per oral formulation, that is a live attenuated, it should be given a week before exposure to the pathogen. For further pieces of info on typhoid fever, enteric fever, paratyphoid fever, everything about it, the epidemiology, the causative agent, clinical features, how to make the diagnosis, full treatment, and even this vaccination, please click on this link. I have full info already published there through this very link. Thanks for listening. Remember to share this. Remember to subscribe to my channel. I appreciate it.